Hi, I think you're muted, but nice to see you. People are going to be rolling in now because we just finished another session. Sorry about that.
Okay.
Hi,
All right.
Emily. We just
Well, thank
finished our
you.
session. Yeah,
Oh, hi.
so people from there
Okay.
will be going to this.
Okay, that's great. So we'll be waiting for the others to join us.
Yes.
Okay.
Thank you. I just want to express our gratitude to you
Oh,
for your time.
this should be fun. This is fun.
Thank you.
Yeah, in the meantime, I could share my screen and play our sponsorship video just to acknowledge our sponsors while waiting
Yes.
for people to roll in.
Right. Okay.
All right, that was quick, but I will let you take it from here. Thank you so much, Dr. Campos, for giving us this presentation. I'm really looking forward to it. And please let me know if you need anything.
All right, will do. Let me just start sharing my my screen. All right. Well, greetings and welcome all
We
to
cannot
this
see your
course.
screen.
I'm sorry.
Oh, we can't see your screen. I just want to let you know.
Oh, it's weird. Okay, there we go. One more try. How about that? Does it work now?
Perfect. Thank you so much.
Okay. Good thing. One more button to push, and we're good to go. Well, greetings, everyone. It's good to have you in my short course, and welcome wherever you're coming from all parts of the world. This session is about telling a story with spatial data from a health equity lens. Telling a story with spatial data from a health equity lens. My name is Annalie Campos, and I am a storyteller, which is one of my favorite roles as a researcher, an educator, an evaluator, a special lecturer for close to 2 decades by now. I currently work for the Michigan Public Health Institute, where I collaborate with public health professionals, public and private institutions, and related fields to understand health equity, social justice, and social determinants of health, among other things. I also teach cultures, global studies, human and world geographies, and methods such as spatial analysis, where you will be delving in quite a bit today. So it's great to be in both academic and nonprofit sectors. Of the multiple roles that I assume for work, I love that part where I can tell stories. But unlike many storytellers, my stories typically, or if not generally, come in one page. Now, you're probably asking, what sort of story is that? Well, the kind of story that I am talking about are maps and making activities that I have been doing for a long time. So perhaps I could tell you one of the most prominent inspirations that I have when it comes to maps and map making. So you're looking on the screen, a map of John Snow's cholera study, where in this map, he started overlaying the incidences of deaths due to cholera and the locations of those sources of water, drinking water for a community, for a neighborhood in Soho in London. So to make a long story short, his findings indicated that there was a relationship between the kind of water that was coming from the pump and the incidences of deaths due to cholera. So there have been many stories about John Snow, and this is just an inspiration to me, because in on a page, he was able to tell and establish a relationship between the incidences of deaths due to cholera and sources of water, where people were getting their water, drinking water from. So when it comes to looking for stories, I gravitate toward using maps. And throughout our existence, whether it's about migration, urbanization, travel, hobbies, the environmental conditions, and crime, there is one perspective that needs to be part of this story, whether it's about more infant mortality rates, world's earthquakes, deadliest earthquakes, where it gives us a sense on this map in particular, gives us a sense of why some places, some countries, some communities are less developed than others, okay? Natural catastrophic events. Maps tell stories. Here's one map that I enjoy doing, a digital elevation model, some part in the northwest part of the United States, where I used a surface function to create a popping, like a really fun description of the Earth's surface using a digital elevation model. So when it comes to all sorts of issues, all sorts of conditions, problems out there, these issues require a different perspective, a spatial perspective, and spatial data. When spatial data are converted into a map, maps become powerful expressions. They are representations of a reality. Good maps, or maps when done right, enlighten, teach, enable us to ask better questions, stimulate engagements and conversations, and they are tools to solve the modern day problems as they have been in the past. So, what is our plan for our conversation today? Well, I typically start with basic foundations, and I'm not going to be delving into deep conversations when I talk about the spatial data. What is special about spatial data? And the other part, we're not going to be able to come up with a story about spatial data without some help of a platform technology in what we call geographic information systems. Now, in letter C, as you can see here, we're going to roll our sleeves and engage in hands-on activities. So I'd like for you to refer to the description of this session, where I posted links for what we're going to use today. You should be able to see a PDF file describing the different activities, 2 activities for this session, and how to access a free web mapping tool we call ArcGIS Online. And here and there, I'm going to drop some, well, I would call it intermittent questioning or check-ins through the polls that I've created in WOVA, right? So finally, well, not really final, I'm going to tell you, which is actually the meat of this session, a special story of a health equity in practice. And hopefully, and I'm really counting on our time management here, is that I will have a Q&A at the end, and also a fun way to end our conversation, also known as pop quiz. And then we can talk about some of our next steps and how you can reach me for additional information and conversations on spatial analysis and particularly health equity. All right. So that's kind of a brief plan of what's going to happen today within 1 hour. So hang on with me and don't just exit without leaving a question or some kind of way to interact with the group. All right, so here we go. What is spatial data? What is GIS? Within this hands-on activities, you may call it a workshop or a training, whatever, but you're going to roll your sleeves and do something, actually get something done before or after this session. So my expected learning outcomes for you and for us, for those of us in the group, is that you develop or even enhance, for those of you who have been in the spatial world, enhance your spatial thinking abilities with the use of geotechnologies. Okay. At the end of this course, hopefully you'll be able to explain various applications of GIS across a variety of disciplines. If you are in nanotechnology, you may be able to come up with a realization of what spatial analysis, what health equity has to do with the area of work that you're engaged in. Okay. And finally, I think the most fun part in this session is that you get to practice how web GIS mapping works for free. And I'm saying for free because I'm counting on the fact that you actually will be able to access the tool ArcGIS Online that we're going to use for this session. And I have tested. Some of my friends from outside of North America were able to access, create an account, and actually create a fun map. And they were able to share the map with me. So that's a promise that I am making here, but depending on where you are, your situation might be different. But keep your fingers crossed, you'll be able to access ArcGIS Online. All right, without so much or further ado, let's get started with what a spatial data is and what is GIS? Well, spatial data is very special because these are information that have location. They have attributes attached to those locations. In other words, spatial data are geographic based. It could be the location or information about where your house is. You have an address. It could be the road segments. It could be a land parcel. It could be a vegetation stand. Look around you right now. Actually, do it. Where are you located? Are you seeing a beach? Are you in front of your house? Are you watching something up, to your right or to the left? Everyone has locational information. That is the beauty of spatial data. Now, spatial data are multidimensional. They can be represented in a 2D or a 3-dimensional. They are also dense. They can provide different representations across scale, from the local, the regional, national, even global. So you see maps of population from your city or town, and then you can aggregate those information into a regional map, including your town and all other cities and villages or places around it. And then at the global level, so you have an information at different levels of analysis or scales. Most of this data, spatial data, requires integration. In other words, they will have a combination of other information. For example, you have a map of the city, of your city. You probably will see a land use map, roads map, where the houses are, where are the central business district, and so on and on and on. A map will have several layers of information, layers of spatial data. And because they can be voluminous, they can be dense, they can be multidimensional, spatial data require significant storage, retrieval procedure, updates, and an infrastructure to be able to manage the intricacies and the complexities of this kind of data. So spatial data is special. So in just a very brief, I don't want to go really deep into this, but when you think about spatial data, generally you can think about two models. One is vector-based data that can be presented in lines, points, and polygons or areas. And the other is picture-based or cell-based. So these two terms will be kind of prominent if you're taking a class in spatial analysis at GIS or geographic information systems. So vector-based, vectors, coordinate-based, and rasters, cell-based, pictures. So let's put this into a concrete example. So if vectors are discrete data, such as points, lines, and polygons, trees, a city represented in points, road segments, as you have seen in this map that I have shown earlier, you see points, lines, and polygons when lines connect in their across or both ends. Okay, and rasters as a continuous data can be represented in pictures. So you probably would think, oh, I'm sorry, the image that I sent you is so pixelated. Each of those pixels that are combined compose the entire picture that you just sent. So depending on your resolution, it could be clear or it could be coarse. Okay, so vectors and raster data. Okay, so here's one of those intermittent check-ins that I'd like to have my participants in my course or in whatever, whenever I'm teaching. I'd like for you to kind of interact with me. This is not a monologue, I hope. So I have here, I hope you can see on my screen very clearly. Let me just pull this down or put this somewhere on my other screen. So, okay, so I have on my screen a real world example. If there are spatial data, if there's a spatial data, there are also non-spatial data. And if you have paid attention to the poll I created about this, you should be able to get the right answer after this brief talk on this slide. So if there is a spatial data, if it's geographic based, and in this example, come on, violent crimes in the United States, for example, if we use a spatial lens to understand violent crimes, as you can see here on the map, you will have some kind of a sense of spatiality because you see this choropleth map is showing different shades of colors representing different magnitude or counts of violent crimes across the country. And right here, a very tiny image gives you a sense of clustering of incidences, not totally related to the map, but just to give you an example of how you can describe a process using the spatial lens. Okay, on the other hand, non-spatial data, right? They generally do not indicate geographic aspects of the process or of the event or of the circumstance. For violent crimes using a non-spatial lens, you will most likely use numbers. It's about 395.7 individuals per 100,000 people, according to the 2021 information that I gathered. So, but it doesn't tell us where in the United States can we find, is this an average? How are the other counties or states compare to this average or of this number? Nothing, nada. You have no idea which state has the most or least number of violent crimes because this information does not come with a geographic information. Okay, spatial versus non-spatial. Now, this is your time. Your turn. Okay, describe the incidences of deaths due to COVID using a spatial lens. Now, I want you to check your polls that I posted online on VOVA and give us an answer there. All right, so let me see if you can give me the best choice. I think I have 3 options that I posted there. My phone is ringing, is pinging, because I'm expecting that those are your answers being registered or caught by WOA. Right. Any reaction? If you can jump into our conversation. I think I can hear you. Let's see. Zijan Saifi said it's clusters of deaths are in urban areas. Correct. Thank you, Zijan. I hope I'm pronouncing your name correctly. All right. So clusters of deaths in urban areas is the best answer for my pop quiz. All right, let's move on. So now let's talk about how we can convert our spatial data into a story, into a map. We use geographic information systems. Now, I may tell you that there are many free mapping softwares that are out there. I use Israel's ArcGIS suite, ArcGIS products. It comes with ArcGIS Online, ArcGIS Pro, and all sorts of extensions. Now, if I may describe GIS in few words, I know you're reading something on the screen. I'd like to think about and describe GIS as a system. It is composed of a number of components, a hardware, a software. Now, we think of software, you think about applications. Microsoft products come with all sorts of software. But in the GIS world, in the spatial analysis world, our softwares are increasingly cloud-based. We have system as a service or SaaS. There are methods. While you have the infrastructure, while you have the hardware and software combined, you need to have a good grasp of the different methods that go into operating the GIS as a system. You've got thinking tools. You need analysts. You need spatial analysts like me who have been working in mapping, web mapping for a good number of years. You need talents. And you need, and when you think of GIS all combined, talents, infrastructure, the methods, the hardware, your computer, and all of this combined, you can think of GIS as one of the major elements of geospatial technologies. Now, here's a fact. Here's a fact. In 2004, the US Department of Labor identified 3 high-growing industries. Can you guess what they are? If you do, send me an answer to the chat room. Or you can also confirm, because according to the Department of Labor, biotechnology, nanotechnology, and geotechnology are high growth industries in the 21st century. In other words, there are jobs, there are quite a bit of interest in these 3 areas, and that's why they are called high growth industries, hot topics, hot button topics of the 21st century. So you can think of GIS as part of the geospatial family as a system that collect information, analyze, manage, store, visualize, or present it or render it on a map, like a map. And it can also, it has a capability to engage in predictive modeling, kind of looking at these scenarios, future scenarios. But most importantly, and here is why spatial data are special, is because GIS requires, first and foremost, geo-referenced data or spatial data, data that has locational information. Okay, So there are other elements of the geospatial technology or technologies, the GPS. Now, you can't go without your phone because if you get lost, you're doomed, right? You must have a GPS in your phones. There is also remote sensing, a method of capturing information from afar. So you have unmanned aircrafts, you've got airplanes collecting information or satellites collecting information on the ground, on the Earth's surface. So all of these belong to what we call geospatial technologies. All right. What's next? So this is about the time where we need to roll our sleeves and start working. Okay, so if you are with me and if you have done quite an advanced work for this session, you should be able to create an ArcGIS Online public account. So what you're going to need to do is click on that link that I created on my session description. And there you will be asked, actually, let me pull how it would look like once you click that link. So it should look something like this. You'll be asked to write your first name, last name, an active email address. You're going to confirm that email and click this box and say next. And then you will receive from that email a link that says to activate or ask you to activate your account. Okay. Now, because I already did that, once you open your account, you will be presented with this kind of interface. Okay. So this is the first landing page that you will see when you have activated your ArcGIS Online public account. Do you have any questions so far? No? All right. So let's move on. So what we need to do is to have that public account. You are going to create a map and use the map viewer to interact with map data. You are going to configure a map, save and share a link, and create a web app. Sounds like daunting and a lot of things to happen in less than an hour worth of session. But that's okay, because you can use this as a homework and also complete at a later time, okay, at your own pace. All right, so let me move to the next slide. So in that PDF file, you will have a like an instruction on how to create and share a map, how to create a map using a text file or CSV file, and in a moment I'll share it with you. I'll demonstrate it with you. And finally, you can share your map, post it, and feel good about yourself that you have accomplished really tangible this morning. That's my hope. And then you'll be able to create a web app, a web application. Okay, all of these can be done in a few clicks of the button. But the first and most important part before you can get started is to create that public account in ArcGIS Online. All right, so while you're doing that, I'm going to give you a few minutes to get situated, so to speak, before I can demonstrate and you can walk with me on how to create, to complete all those 2-3 different tasks. I'd like for us to engage in a talk about a special story where in this case, you are going to need or require an additional tools, not just the public account, to complete the map that I'm going to show you. But here's a quick story. Where is this coming from? Why am I here in GARD? So I work with people who are very interested in understanding health equity, health inequities, and the causes and sources of health inequities. In fact, if I may invite you to complete this survey or pass that survey along, pass the survey link to people you know, that will be most appreciated, because I wanted to hear your stories. I wanted to get a clear understanding of how health inequity and how health equity is articulated from different parts of the world. So please do complete the survey. So health equity is typically understood as a process and an outcome. So a process because there are certain conditions that need to be removed so that everyone, regardless of age, cultures, and practically everyone, will have a fair and just opportunity to be as healthy as possible. So with that pretext, I'd like to tell you a quick story. Vanchi's here. We've had conversations on what she does one day, and I was asking her, you know, what is she up to? Is she still doing the electronic notes? And then she told me her story of her journey in developing a rapid diagnostic tool to detect TB. And on, she described to me the really jargony stuff. And all I can think of was to ask her, why are you doing this? Why are you developing an instrument that will compete with those companies that are selling a detection tool for TB? And her simple answer really opened my eyes of how she is engaging in what I call, from my lens, health equity in practice. Her story is such inspiring that I thought, wow, if she is developing this tool so that those populations and communities who do not have the capacity to test whether they have TB or not, if this is her goal, this is, to me, is a systems changing goal. And when I think about that, it requires a different kinds of lens to solve, to address the most health inequities that we can find out there. And quickly, here is a model of how a systems change can address the health inequities or all sorts of problems out there. And what Vanchi has just shared with me was an explicit structural change, allowing communities to access to tools, to resources that would have been otherwise not or inaccessible because they are poor. The conditions, the environment does not allow them to access or to have the most expensive diagnostic tools that are currently are in the market. So it is, to me, a health equity in practice. All right, enough of that. Thank you for inviting me, and I get to share this story to everyone. So when we look at tuberculosis across the world, you can see where the concentrations and an immediate need to send this diagnostic tools so that there will be a change in how health, when it comes to tuberculosis, will be addressed. So this is the core of my talk. Okay, this is the core of my talk. The social equity analysis solution. So at this point, it would be relevant for me to take you to another platform, an ArcGIS platform called ArcGIS Pro, to complete this social equity analysis solution. So what I did or how is this working? So you have a particular condition. It could be a tuberculosis. It could be mental health illness. It could be all sorts of health-related conditions that are out there in your community. You choose that, you focus on that, and then you identify the community characteristics. Okay, so you have the community condition as an outcome of this process. Then you look at across space the communities that you want to make a decision to locate some kind of an analysis or to solve a problem. If it's tuberculosis, where across the world will we bring, where in the world are the most needy population, the most burdened population because of TB or other health condition. Then together I produce what we call equity analysis index map. And at the end of that process is an ordering, a ranking of priority locations for intervention. Okay. So this may look like a high level description of what goes behind on my social equity analysis index map. All right, so altogether, the social equity analysis provides a solution to identify community conditions, burdens, evaluates the existing assets, and where the most needy locations or groups of people need to be attended to. Okay, so I applied the social equity analysis solution to understanding mental health and where are the most burdened communities in the context of Southeast Michigan. So mental health has become really a high, very concerned public health issue or problem, especially with COVID and all the implications of the COVID, the pandemic. In fact, 1 in every 8 people in the world live with a type of mental health disorder, according to the World Health Organization. So here was the problem. So where in Southeast Michigan will I recommend for intervention? The goal was to locate places or neighborhoods needing an intervention the most. And the process is what I just described earlier. I identified the community condition, mental health, incidence of mental health, and the community characteristics, race, participation in health insurance, and all sorts of demographic characteristics. And in the end, I came up with this map. The heart-shaped map represents health centers within 1 mile or so from the neighborhoods. So what you have here is a tool where you can bring this to your community leaders, people you work with, and give them a clear picture of where might the next or the priority communities to intervene. And so just by eyeballing, I circled some of those areas where health centers are non-existent. Okay. And I think I didn't give you a chance to ask questions or say something about the map. But it is a tool that you can take for ground truthing, for example, to interrogate the actual circumstances on the ground. You can visit the communities and you can actually check it out, the communities out, and see whether there is indeed no access to a health center. And so I take spatial equity analysis as one of the most powerful tools to have, skills to have, and in making a difference in our communities, particularly when it comes to addressing health inequities. Okay, so now I have a few minutes left, and I wanted to check it out and see if everyone was able to access the ArcGIS online. Can somebody tell me? Right, very quickly, very quickly. Unless you have anything that I need to address before I quickly demonstrate how ArcGIS Online works. Anyone? No, I'm not seeing anything in the chat room. So let's see. So this is the classic map viewer. Okay. So first thing that you need to do is to add data. Now there are different ways for adding data into your map. You can search for layers. Don't go to your My Content, but go to ArcGIS Online. So in my instruction, I wanted you to search for, let's see, Human Development Index. And even if you just click on one of the different options that you have, this is kind of old, but just to demonstrate how this works, you have now added, I'm still waiting. You should have something like this on your map if you were able to access the public account, a public account in ArcGIS Online. So now that you have a map, and you can continue adding more maps, layers of maps, but for our purposes, I'll just stick to this one. You can change. Hold on. You can change the base map as well. It will create a different background. You can create measurements from one point to the other. You can also, okay, hold on a sec. And you can make changes in terms of changing the representations. You can change colors and create all sorts of configuration on this map. I will quickly go to Save As because I want you to save your map. You can say HDI, and you can add a tag. You can briefly describe, and you can save the map. So now is the fun part. How will you share your map? First, you're gonna click everyone in the public so that your map will be accessible by just everyone who has a link, this link. And you can also create a web app. Okay. When you are directed to this page, click on the basic because it's free, first and foremost, and there are other options. And then when you click create a web app, you will be directed to see done. So the link that I just copied can be pasted as an attachment to an email, and there you go. Okay, any questions? So in creating the web app, you have different steps to go through. You select the map, you click next, click next. You can do all sorts of configuration. And when you publish and when you confirm, your web map, your web app is successful. That's how easy it is to work with ArcGIS Online. You can copy the link, and when you write me an email, you can show that you have actually completed your web app, and you launch it, and it will be listed as part of your products in your My Content. Any questions? So I know I have a few more minutes left in my time. The last thing that I want to do in this short course is something fun. So hang in there. All right, so if you want to learn more about health equity spatial analysis, don't hesitate to connect with me, okay? And I just wanna thank MPHI for allowing me to work with you, with Michigan State University in this fun short course. And also one of the most fun educators that I always connect whenever I have a question about spatial analysis is Dr. Joseph Persky. Before I let you go, I have one last thing to do, and that is see if you all can do this. I want us, as a way of checking whether you have retained some information in this course, I want you to go to kahoot.it and see if you can participate in this fun game, okay? Kahoot.it, KAHOOT.it. This is not going to go through Wova, but directly into your cell phone or your gadget that you're operating right now. All right, so let's see if we can work on this. I want you to go to www.kahoot.it. And then it's gonna ask you to load this game pane. We can actually gamify our experience here in this course. All right, I'm waiting for players. Let's see if this will work. Right, the game pin is 921-8315. I got one participant. Yay! Go, Rubenta. Go, Zijan. Keep going. Vanji, Melissa. We'll see who gets to win this competition. You get to stand on a podium at the end of this game. I'm going to give you a few more seconds. Ready? All right, it looks like there are 1, 2, 3, 4, 5 so far. Can I get started? I only have 5 questions. All right, we'll see. The link is www.kahoot.it. Right, someone is asking for the link. Someone still wants to join. That's all right. All right, is everybody ready? Mohammed, are you ready? All right, so let's just get started. First question's coming up. That's the title. The art and science of map making is, now in your cell phone, you should be able to see these different colors, and whatever answer that you think is right, click now. You have just 20 seconds. 2, 1. All right, biogeography. The answer is cartography. Next. Now we're gonna see who's in the high ranks. Next question. Can you download geospatial data from ArcGIS online? Yes, no, sometimes, all the time. 7, 6 more seconds. 3, 2, 1. What's the answer? All the time or yes? Either would give you points. Let's see who's on the ranks. Melissa is top. Let's ask the third question. GPS, remote sensing, and GIS are key elements of what is it? Family of what? 5, 4, 3, 2, 1. Woo, geospatial technologies. All 3 of you answered correctly. Let's see what's the scoreboard look like. Melissa is still on top. Go, Melissa. Fourth question. A survey and an app, a web app, are some activities to complete beyond this session. What homework? According to my kitty. No, yes. Hopefully, yes, is the answer. All right, the scoreboard is showing Melissa, followed by Mary. Last question, is true or false? It's all about health equity. Five more seconds. Yes, true. Let's see who is in the podium. Benji is in the 3rd place, Zishan, and it is Melissa. Well, thank you so much for your participation. I hope you had fun. I hope you're coming away with not just an information, but a way to move forward with whatever it is that you're working on in GARD and beyond. Thank you so much. I have 3 more minutes to spare, but I just wanted to thank you for inviting me to join GARD.
Dr. Campos, I just want to express our gratitude to you on behalf of GARD for such a wonderful presentation and a fun one. And thank you for your time. We really appreciate your input and encouraging presentation.
Well, thank you so much. I had fun and hope to see you around throughout the week. Thank
Yes.
you.
Thank you so much. We are grateful.
Thank you. Bye.
Bye. Thank you, Annalie. That was great.
Well, that's
Okay.
always fun.
To get to the
Yeah.
other, side, but thank you so very much.
Yeah.
I really appreciated it.
You're very welcome.